Welcome everyone who's joined us. Hi, thanks for coming and getting here on time. We are excited to start class number 2 of the acupuncture and nutrition series with Dr. Robert Baritz. And we are just moments away from getting started. I'm gonna just say, if you haven't joined us before, you are in for a treat. This is how we do it. Dr. Baritz is going to be speaking. He's going to be asking you questions and interacting with you. At this point, sorry, it's me. At this point, you're going to be using the chat box. As you can see, you've got to click at the bottom of your screen. You see a chat icon and you see a Q&A icon. Click on both and you will see the chat is when Dr. Baritz asks you something like, how many people enjoyed last week's class? Whatever he wants to ask you, you type it in the chat box. Can I get a hallelujah, whatever. If you have a question for Dr. Baritz regarding what you see, put it in the Q&A box, because then it's too distracting to answer questions while we're going. So interactive questions, just like Rhonda Perkins did, please use the chat box. If you're going to ask a question about nutrition or the acupressure, something you've seen today, please use the Q&A box and we will get to all questions at the end of the evening. So with all that preamble, I would just like to say welcome everybody, and please enjoy Dr. Robert Baritz.
Hey, welcome to How to Cool Hot Flashes and Sleep Better. Well, this has been like a little bit of a personal journey for me, and I've seen like a lot of disruption in women's lives and how it affects their family. And so I made this a little bit of a personal mission, or a big part of my personal mission, to help women get through this part of life. So menopause. Menopause is the time that marks the end of a woman's menstrual cycles. It's diagnosed after a woman has gone 12 months without a menstrual period. Menstruation can happen to women in their 40s or 50s. The average age is 51 in the United States. However, I've had women in my practice where it starts in their 30s or in their 60s. The word menopause comes from the Greek words menos, meaning month, and pause, meaning to cease. So menopause means the monthly period stops. And menarche means the monthly period begins, which is the primary event of puberty, the first cycle of bleeding. Menopause stages. Perimenopause encompasses the years leading up to menopause. It's characterized by well-known symptoms like hot flashes, moodiness, and the dreaded weight gain. Menopause is not diagnosed formally until a woman has gone 12 months without having a period. Once a person has passed through menopause, they are defined as being in post-menopause. So stages of menopause: perimenopause, menopause, postmenopause. Menopause is a natural biological process characterized by hot flashes, trouble sleeping, irregular periods, vaginal dryness, chills, and perhaps mental disturbances. Additionally, menopause is also characterized by loss of muscle mass, as I mentioned, which is a precursor to loss of bone mass, night sweats, more mood changes, more weight gain, and slowed metabolism. Now, the treatment options are hormonal therapy, and we call this working against nature. Lifestyle changes, and we call this working with nature. nutritional supplements, herbal therapy, acupressure, and acupuncture. Going back to hormonal therapy just for a minute, of course, if a woman chooses to do this, that absolutely is their choice, and I always work with them. But the hormones are so powerful now, they can take a woman who is in the prime of her menstrual cycle and stop those cycles with hormonal pills. And they take a woman who ceased menstruation and start those cycles with hormonal pills. And so these are very, very powerful medications, and it would be unlikely that they didn't have side effects. As a matter of fact, the side effects can be quite powerful. It's the well-known discovery of the risk of cancer after hormonal therapy was well established over 15 years ago. Then they transferred to low-dose hormonal therapy, but yet the side effects are now still being discovered and publicized. So it's an informed decision. Each woman has to make her own decision what she wants to do. But I certainly would recommend, whether or not she's taking hormones, to follow the lifestyle changes and the other things we're going to talk about. In this webinar, I'm going to talk about nutritional supplements, herbal therapy, acupressure, and acupuncture. I leave the lifestyle changes to her, holistic physicians. Okay. So everything that's important in this seminar, I've put in a download for your patients. And this, you can see this is the first page of the download, or what I call the quick reference guide. And right over here is the link, so your patients can link to the video that you're going to see a little bit later on. This page over here gives the all-important definitions for understanding how to find acupuncture points. Words such as anterior and posterior, lateral and medial, proximal and distal. And then we cover the unit of measurement, the soon, which is the proportional inch. The next thing that your patient will see are the supplements. And as you can see, I was able to create what I consider to be an ideal program for your patients with only 5 supplements, which is a miracle in itself. And I've listed a few additional supplements with the reasons why, and we'll cover all that in a few minutes. Over here is the medical advice disclaimer that's important for your patients. Over here, if you'll permit me a short advertisement, I've created 4 programs for your patients. These are courses on an online learning platform: how to heal a concussion fast, improving erections, new hope for Alzheimer's, and relieving carpal tunnel syndrome. So these courses are available to your patients. If you wish to offer them on your website, you can just contact me and become an affiliate, and you'll receive 20% of the value of the courses that your patients purchase. And just contact me and I can give you the rest of the information on that. So let's get on to the first supplement that I recommend is Simplex F, or Paraplex if the ovaries are removed. It's 3 upon arising and before bed. These products are listed in order of importance. So if a patient says, look, doc, I can only take one product, then this would be the product for them. Simplex F is good for provides a thyroid, Simplex F is good for the ovaries, the adrenal glands, the pituitary gland, and the thyroid gland. Paraplex supports the health and the function of the pancreas, the adrenals, the pituitary, and the thyroid. So it doesn't have ovarian support. If the ovaries were already removed, then there would be no need for ovarian support. Instead, we offer pancreas support. Simplex F typically will produce results, noticeable results in the female patient within 2 weeks of consumption at this dose. The woman will feel perhaps more balanced. She might feel more centered in her environment. The physical environment might seem to be brighter for her. She may feel more rested in the morning, even if her sleep isn't any better, or her sleep may be better. Also, many women will experience a boost in overall libido. Sometimes these results are profound and marked, and it's like, wow, this is great. Other times, they are much more mild in results, and you're going to have to ask her to pay attention so she can notice the results and report them back to you. If she's not getting these results, then she's either not taking the tablet or she needs hypothalamex or hypothalamus PMG to be added to the program. As a side note, I have found clinically that this product will help increase the pheromones produced by the woman's body, and her husband may be more attracted to her simply because she's taken this product. Really a remarkable result, and another check the box reasons why I always recommend standard process products for my patients. Just as a quick side note, when I started with standard process products, I decided that what I was going to do was recommend standard process products, and if it didn't work, I would then go to other brands. Well, fast forward 20 years later, I never did have to go to any other brands. Next product is Prolamine Iodine Plus. This is high-dose prolamine iodine built off of the Lugos, the famous Lugos solution, provides thyroid support. It is for short-term use, not for children or people who are sensitive to iodine. Short-term use means use it to get those hot flashes under control, then phase her out and maybe just use a low-dose iodine product after that. Use it again at the high dose if the hot flashes return or become uncomfortable. The next is Wild Yam Liquid, 1 teaspoon upon arising, to relieve temporary mild discomfort associated with menopause, to relieve temporary mild discomfort associated with menstruation, to provide antispasmodic activity, and to relieve occasional digestive discomfort. There is no scientific evidence that shows it's better in the morning to be taken than other times during the day. But I can tell you as a clinician that taking it first thing in the morning produces the desired results. And so I tell my patients, just put this by your bedside when you wake up, shake up that bottle, take a teaspoon of that, gobble it on down. Most women will take this straight, mix it with a little bit of water if you want to, and you're going to set the stage for a fast recovery. I know there are tablets available, but nothing produces results like the Wild Yam Liquid. That's why that's the product I recommend for my female patients when they're getting started with this. I want them to get a quick result so they know the product is working for them, and they can continue this for the whole time of menopausal symptoms for as many as months or years as it takes. Next product is MenCheck twice a day, three twice a day, supports nervous system health. It's a moderate calmative that helps maintain emotional balance. It's not a calmative messing with brain chemicals or anything like that. It's a calmative because it calms the autonomic nervous system, calms down the parasympathetic, the frayed parasympathetic nervous system, and feeds the all-important minerals to the, it calms down the frayed sympathetic nervous system and feeds the all-important minerals to the parasympathetic nervous system. And clinically, it helps ease the effects of temporary stress. This is also great for adults with quote-unquote ADHD, if you believe that, at least with the symptoms of ADHD, whether or not that we agree that that's a true disease. Next is Adrenal Complex, 1 tab twice a day. I love this product. You use it to restore adrenal gland function, to support adrenal gland health, and to help the body adapt to the challenges of everyday life. This product does have high-dose licorice in there. That means that it can scoop up potassium, so it's not good for patients who are taking edema, who have congestive heart failure, who are pregnant or lactating, and it's contraindicating high blood pressure because the high blood pressure medications also are not potassium sparing. So if patients take high blood pressure medications, just skip this. We have other fabulous products for them, but for most patients, it's going to be great. This is excellent for the person who is wound up and run down. And I tell my executive patients or my stress patients, they can suck on this like a lozenge if they're feeling stressed. And within 15 minutes, they're just going to feel better. Okay, so that's the basic protocol. Also consider, based upon the symptoms and clinical picture, black currant seed oil 3 twice a day. It supports the healthy immune system, supports normal blood flow, it supports normal tissue repair processes, and it's excellent for breast health. Immunoplex, 3 upon arising and 3 before bed. This is for any women who have immune challenges. It's full of vitamins, micronutrients, minerals, and tissue extracts that support the immune system. So all these different extracts that it has in there, all these plants and animals, this again is another check the box reason for the standard process approach, because nobody compounds products like standard process does, and especially like this product designed over 50 years ago by our friend, Dr. Royal Lee. Okay, Cardio Plus supports healthy functioning of the heart and other muscles, supports healthy coronary blood flow, provides ingredients with the all-important antioxidant activity, and increases and supports increased oxygen demand during exercise. So it is oxygen sparing. So if a person is doing exercise, they're only taking in a certain amount of oxygen, well, this is oxygen sparing because it helps your body do more with less oxygen. Next product is lactic acid yeast wafers, and this is 3 twice a day, and this is for anyone who needs probiotic or prebiotic support. This cleanses and promotes the healthy function of the lower GI or gastrointestinal tract. While we're talking about this, I'd just like to talk about the appendix. So quickly, how many people have heard that medical profession does not know that there's a purpose for the appendix? Now, you may know, but quickly in the chat box, does the medical profession admit that they know the purpose of the appendix? Just give me a yes for a yes and a no for a no. Well, whether or not the medical profession knows, we know. As it turns out, the appendix is a storehouse for your own personal microflora. So if your microflora is damaged for any reason, and the gut is lacking microflora, your own personal microflora stays in the appendix, and then it can come out and reseed the area. But when it comes out to reseed the area, like new grass, it needs a protected environment and it needs the right nutrients. And lactic acid yeast wafers are the prebiotic, the fertilizer, and the anti-weed product that prepares the area for your patient's unique microflora to come out from the appendix and then reseed itself into the colon. And so this tells us that lactic acid yeast wafers are not needed every day. They're just needed, maybe for a couple of months or maybe a month, and then you phase off as the patient rebuilds their own flora. Okay, calcium lactate tablets, 2 twice a day, supports muscle contraction and nerve conduction, supports maintenance and function of cell membranes, supports blood coagulation, supports and helps maintain healthy bone density and remodeling, and adequate calcium as a part of a healthy diet, along with physical activity and in particular strength training, may reduce the risk of osteoporosis later in life. So if a woman is concerned about calcium, osteoporosis, I recommend strength training and calcium lactate tablets 2 twice a day. B6 niacinamide 3 twice a day supports a healthy nervous system and supports energy metabolism. So if the woman you're working with has low energy, the product is B6 niacinamide 3 twice a day. If her energy is fine, just skip it. So let's go now and see the acupuncture points that I recommend, that I've selected based upon thousands of years of research, not my research, but thousands of years of research for helping women going through the menopause cycle, how to cool hot flashes and sleep better.
Hello. In the next few minutes, I'm going to show you how to locate and activate 3 acupuncture points that have been used to reduce hot flashes for hundreds of years. There is a natural decline in estrogen and progesterone when a woman reaches her 40s or 50s. Monthly periods become less regular and eventually stop. Hot flashes and sweats are a common problem. Hot flashes can disrupt sleep, and some women break out into a sweat so often that it interferes with their daily living. Hormonal changes can also cause sleep problems, difficulty concentrating, moodiness, anxiety, and depression. Vaginal dryness, weight gain, dry skin, thinning hair, and a higher risk for osteoporosis are also associated with menopause. Menopause is a natural process, and treatments focus on symptomatic relief. Vaginal dryness is treated with topical lubricants or estrogens. Medications and hormone replacement therapy can reduce the severity and frequency of hot flashes. However, hormone therapy poses significant risks, and medications are more of a temporary fix, with symptoms returning if medications are stopped. The good news is that several studies have shown that stimulating acupuncture points can significantly reduce hot flashes, and in one study, night sweats were reduced by over 1/3 in menopausal women. Another study found that women receiving acupuncture experienced less hot flashes, less sweating, less sleeping problems, and just felt better. And a 2001 review published by the British Medical Journal noted that several studies demonstrated that acupuncture has a beneficial effect on the symptoms associated with menopause. Experts in acupuncture strongly recommend that herbal formulas be taken to enhance the effect of acupuncture treatments. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first point for menopausal symptoms is bladder 62. Bladder 62 is known as extending vessel, indicating that it opens the blood and lymphatic channels. In addition to helping reduce the frequency and severity of hot flashes, bladder 62 has been used to reduce headaches and sleeping disorders. Activating bladder 62 can reduce nervous system overload, leaving one feeling calm and refreshed. In Asia, bladder 62 is also used for stress-related pains, heel pains, and epilepsy. To locate bladder 62 on the outside of your left leg, find the tip of your ankle bone, right about here. Then move down to your off the ankle bone, just like this. Now press in to find a spot that is sensitive, sore, tender, or painful. That is bladder 62. Activate this point by rubbing it quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now find bladder 62 on your right leg and repeat. The next point for hot flashes is kidney 6. Kidney 6 is known as shining sea. Shining sea is an analogy for the limitless possibilities that can be imagined if you're looking over the ocean towards the horizon on a warm day. In addition to helping with menopause symptoms, kidney 6 is used for asthma, constipation, frequent urination, and to expedite labor, but it is not recommended during the course of pregnancy. Kidney 6 is located on the inside of your ankle. To locate kidney 6 on the inside of your left leg, find the tip of your ankle bone right about here, then come down till you're off the bone right about here. Push in to find a spot that is sensitive, sore, tender, or painful. That is kidney 6. Activate kidney 6 by rubbing this area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now locate and activate kidney 6 on your right leg. The third point to reduce the symptoms associated with menopause is spleen 4. Spleen 4 is known as the grandfather-grandson point, signifying that spleen 4 is used to address the changes associated with the cycle of life. In addition to helping reduce the frequency and severity of menopause symptoms, spleen 4 is used to help with acid reflux, upset stomach, irritable bowel, and any other symptoms associated with the GI tract. Spleen 4 is located on the inside of your foot. To locate spleen 4 on your right foot, find the base of your great toe right here. And on a skeleton, it's right over here. Now move your finger along the bone till you come to a little knob right over here. Now press into the spot that is just a little bit lower than that under the bone, right about here. Find a point that is sensitive, sore, tender, or painful. That is spleen 4. Activate spleen 4 by rubbing it 5 times quickly. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now find and activate spleen 4 on your left side. If you are bothered by hot flashes, night sweats, trouble sleeping, moodiness, or any other symptoms associated with menopause, I encourage you to activate bladder 62, extending vessel, kidney 6, shining sea, and spleen 4, grandfather-grandson, once a day for 30 days, then as needed thereafter. If you know someone who's dealing with menopause, I encourage you to share this video with them. It is intended to help them manage the symptoms and just might change their life.
So that completes our video, and I see that many people did chat in the answer to my question, and I'm now available for any questions that you have.
Great. We have a couple. I know we're a little late. Remember, Constance, put it in the Q&A box. First question. How long does menopause last? And I would believe that is person by person. And how do you define postmenopause?
Well, it's funny. I really spent a little time studying that. Menopause apparently is just an arbitrary moment in time. So truly you have a perimenopause. That's when menstrual cycles become irregular. Women has maybe hot flashes and other signs. And then you have postmenopause when menstruation is ceased for 12 consecutive months. So menopause apparently is that moment, that 12 months, that moment of at 12 months when menopause is ceased for 12 months. So it's really this sort of arbitrary moment, but it's usually generally termed to define those symptomatic period, starting with perimenopause right on into the symptoms that continue during postmenopause. Menopause finally ends, in my mind, when all symptoms classically associated with menopause cease. So if the woman doesn't have any hot flashes, she's not having, her metabolism is back to where it was, and she's not having any trouble sleeping, then you could say she is through menopause and thoroughly into postmenopause.
Great. And this is a good question. I like this one. What if your appendix has been removed?
That unfortunately means that, well, I'll tell you two things. The body will attempt to create a new one. And so I believe that studies would show a little bit of a node may be beginning to grow in that area, or a pocket may develop in the colon, or pockets to preserve your own personal microflora. But it just is not quite the same as if you had your own. So you might need more support. So if a person, has antibiotics and it damages their microflora, there might need more and longer support to rebuild their own flora. But it will rebuild, it will reseed.
All right. What about women who get the jab and now have their period? Okay.
Yeah, all right. So then that means they were still in the perimenopausal period. Unfortunately, well, fortunate or unfortunately, the jab upsets. We know that getting vaccinated is intended to affect the immune system. That is the intended result. And it affects the immune system by using an exogenous method. That means the method coming from outside going in the body. For example, when we use acupressure or we use supplements, this is an endogenous method. So we're cultivating the immune system. You don't get side effects. But if you affect the immune system by using something from outside the body, it then disrupts all of our systems that are associated with the immune system, which of course includes the hormonal system and the neuroendocrine system. And that's why we're seeing these other symptoms. So, if the menstruation returns, you just got to do the menopausal protocol. Plus, I suggest adding the immunoplex, because we already know the immune system is now in need of rebalancing.
Got it. What is SP6 called?
Spleen 6? Good question. Let me take a look at that. Spleen 6 is known as 3-yin intersection, San Yin Jiao.
Okay.
They call it 3-yin intersection because it's the intersection of 3 yin, or nurturing organs, spleen, liver, and kidneys.
Okay. And that previous question of the person getting a vaccine, or they're having menopausal symptoms after the vaccine. So that's really what it is.
If they didn't have menopause, if they didn't have any symptoms, and they were a menstruating female, and now they have the symptoms, then it's kicked them into perimenopause.
Or a hyper endocrine response, right? So as Dr. Lee would have said, you can go hyperthyroid and simulate menopause as well, right? Because you're getting the hot flashes and the fatigue and some of that stuff. So there could be some hyperstimulation to the adrenals and thyroid hypothalamus and pituitary because of that.
Exactly. Thank you, Ben.
Sure. Is Ki6 opposite BID 62?
Kidney 6, opposite, the other one that I gave, I don't have the exact formula in front of me. Kidney 6 shining C opposite what?
The person wrote BID 62, BID 62. Do you want them to clarify that?
Bladder 62? BL was it?
Yeah, BLD, sorry.
Yeah, bladder
Always,
62. Yes, good observation. You know, I kind of wish I'd written that in the video because, yeah, great observation.
Great. So in the person to come on, like the patient with those menopausal symptoms is in her 90s. So I'm guessing it was a reactivation of endocrine from the immune response.
I think you nailed it there, Ben.
All right, and here's one a little different, but I no, not different actually. So with these patients, would you recommend Orchid PMG for low testosterone?
No.
Right.
So the woman doesn't have a testicle, and therefore the PMG, when you really get into the PMG theory, you'll see that it's not really going to be effective. It's maybe Orchex, that would be a fabulous product, which is which is a testicle extract. That would be great, but not the PMG. And that's why we don't give the Simplex F, because the ovary PMG is not really going to be effective if the ovaries have been removed.
Right. And Tribulus can be a thought. It works for female endogenous testosterone just to the point of normal production. You know, it won't push them beyond, you know, will not cause them to grow a beard.
Right, no beard, and they're not going to come out looking like Arnold
That's
Schwarzenegger.
Right. But it will help with muscle development, especially if they're athletes, and it will help with sex drive. So
Yeah.
Take that for what it's worth. And then one last question here. How many son is spleen 4 from last gig toe digit? GIG toe digit.
Okay, how many soon, C-U-N, and a soon is the unit of measurement, the width of the thumb at the first, at the only knuckle, the only joint, and which spleen 6 did she say?
Spleen 4.
Spleen 4, of course. You know, that is a good question. In the reference that I use, the Pictorial Atlas of Acupuncture, this is the German published book by H.F. Ulfman. They do not give a soon measurement. They rather give the location. And I'll just read that again. And it's in the depression distal and inferior to the base of the first metatarsal bone. And it's on the dividing line between the red and the white flesh, or between the top of the top skin and the skin on the bottom of the foot.
Great. Well, that looks like that was it. You need to find it via palpation. We got from a comment from one of our acupuncturists.
Yeah, thank you.
And would you advise adding spleen desiccated or PMG?
Absolutely, because we're already activating spleen, 3 yin intersection, I believe. If that was, if I put that in the protocol, but anyhow, spleen absolutely would be a great product to use.
Yep.
The spleen
Great.
support would be a good
Well,
idea.
we're at time, so.
All right. Well, thank you very much for listening.
Yeah, thank you everyone for being on. We'll have that recording going. Someone said, how about whole adrenal, desiccated adrenal? But of course, that can be helpful. If you want to, you have any words to that? Adding in adrenal desiccate?
Adrenal Jessica is a short-term support product because it doesn't rebuild anything. I use it frequently for 1 or 2 bottles, and then I move off into something else. But if you want to give a woman, quick relief, or for that matter, I give it to people who've had bad shocks, marital breakups, loss of boyfriends, a decease in the family, severe auto accidents, loss of job, family disruption. I'm always quickly giving them a couple of bottles of that to just get them through that, and then move on to something else. Great choice.
Great. All right. Well, thank you so much. Thanks everybody for being on, and we will see you in a week.